All right, welcome to The Explainer. Today, we're diving into a new frontier in medicine, one that tackles a challenge that sounds almost impossible, the quest to truly measure the human mind.
So let's start with a really big question. How do you measure a feeling? I mean, really, how do you put a number on an idea? And most importantly for medicine, how do you objectively measure a psychiatric diagnosis? This has been the central puzzle for mental health care for, well, over a century.
You know, even with all the incredible progress we've made, modern psychiatry often still works in a subjective world. Assessments can be inconsistent, and they tend to rely on describing symptoms. But the goal, the real holy grail here, is to make a leap from that subjective descriptive model to one that's objective, consistent, and can actually get to the precise causal mechanics of what's happening in the mind.
So that sets the stage perfectly for our first section, Psychiatry's Measurement Problem.
Just think about how it works right now. A diagnosis usually comes from a conversation, from you describing how you feel, and the clinician interpreting that story. And look, that's incredibly valuable, but it's still subjective, right? Two different doctors hearing the exact same story might arrive at slightly different conclusions. The vision here is pretty incredible. It's about making navigating the mind as clear and data-driven as using a GPS is for travel. Just think about that. A clear, objective map to guide treatment, instead of trying to read the signs and kind of guessing which way to go. That's the level of ambition we're talking about.
Okay, so if we're going to build this GPS for the mind, how would we even do it? Well, that brings us to a really fascinating potential answer. Let's get into it. So what is the Psychiatry Hat? Well, it's this revolutionary head-mounted wearable. And let's be super clear, this isn't some consumer wellness gadget. No, this is designed from the ground up to be a serious clinical tool, one that provides objective, measurable data for diagnosis. And here's where it gets really cool. The secret sauce is how it combines a ton of different data streams all at once, in one single device. It's got EEG to measure brain waves, sure, but it also has eye tracking to see what you're focusing on, geopositioning to see where you go, and even motion and voice analysis. It's this whole integrated picture that aims to capture a full snapshot of behavior.
But, collecting all that data is just step one. The real magic, the real innovation is what happens next.
It's a three-step journey, really, from just raw noise to actual insight. First, it collects all those signals from all the sensors, and it does it in real time. Then comes the really crucial part. It synchronizes all that data and filters out the noise, things like you moving your head, to make sure the data is clean. And finally, it transforms that clean data into something totally new, a unique digital signature of a person's brain and behavior. So, what's the point of this digital signature? What does it do? Well, it's the key that unlocks that big goal we talked about right at the beginning. It's what could finally make a diagnosis objective, incredibly precise, and personalized right down to your own unique biology.
All right, let's zoom out for a second, because this isn't just about one fancy piece of hardware. It's about a potential shift for an entire field of medicine. Welcome to the vision for precision psychiatry.
Something like this doesn't just appear out of nowhere. It's only possible because of some massive hurdles that had to be cleared first. We're talking about huge engineering feats, like creating tiny, super high-quality sensors, figuring out how to get clean data even when someone's moving around, making the battery last in the real world, and of course, doing all of this while meeting strict clinical standards like HIPAA and the FDA.
So that begs the question, why now? Why is this all coming together at this exact moment? And it really seems to be a perfect storm. First, you've got the technical edge. This is the first truly integrated platform of its kind. Then there's a huge clinical need for better tools, especially for things like detecting a relapse before it happens. And finally, there's a clear market gap. Big tech is all over wellness, but they've left the serious clinical psychiatry space wide open.
And when we talk about a market gap, well, let's put a number on that to see just how big it is. The global psychiatry market, it's a $400 billion market. That's the sheer scale of the opportunity for tools that can bring objective data into the clinic.
And this really gives you a sense of the sheer ambition here. The vision isn't just to be another tool. It's to make this thing as essential to mental health professionals as Google is to search. I mean, wow. That's not just a product. That's a fundamental change to how the work gets done.
At the end of the day, though, this isn't about collecting cool data. It's about what that data can do. It's about impact. The idea is that this could lead to much better outcomes for patients, help us develop new drugs way faster, and make advanced treatments like neuromodulation much more effective. It's all about improving care and speeding up innovation.
So we'll leave you with this one last thing to think about. Beyond the clinic, beyond the technology, what really happens to our understanding of ourselves, of society, of health, when the human mind becomes truly, deeply measurable? Thanks for joining us on The Explainer.